Thank you very much for the presentation, and let me introduce in the following 20 minutes about this survey that we had made with other physicians about awareness of probiotics in a survey of 10 countries. We already know that probiotics are live microorganisms which are beneficial, improving the health of the host. For that reason, several studies have shown the effectiveness in preventing and controlling different diseases such as GI disorders, immune system disease, allergies, atopic eczema, and also obesity. But the probiotic definition implies that its consumption affects the composition of the intestinal microbiota. That is to say that there is an impact in a beneficial way on patients' health, modifying intestinal microbiota. There is a lack of understanding that probiotic effects in the intestinal microbiota is the biggest obstacle, promoting skepticism about its use. We know also that physicians' knowledge usually concentrates on two groups of probiotics, lactobacilli and bifidobacteria, ignoring the vast array of other species that inhabit the intestinal tract, despite a vast scientific evidence. For that reason, with the group, we make two questions. The first one is if there is a scientific evidence reaching physicians properly, and what is the impact of this evidence on their medical practice. For that reason, we make a principal objective that it was to evaluate the knowledge level, attitude, and current practices of physicians with regards to probiotics in 10 countries. The physicians we survey were general practitioners, pediatricians, and gastroenterologists. The survey was conducted in 10 countries. The countries involved were Peru, Argentina, Spain, Italy, Hungary, Morocco, Turkey, Pakistan, India, and China. The sample size we established from 90 to 119 physicians interviewed per country, with a total sample size of 1,670 physicians. The representative was adapted criteria according to each country's reality, and we use a quota method for this representativeness. And the physicians answered a close-ended questionnaire that it took 8 minutes. The form of we established the answering the survey was online in the majority of the countries, but in some of them, like in Morocco, Pakistan, and Peru, we have to make the survey face-to-face. And we analyze 5 topics in terms of medical knowledge: the knowledge level, the attitudes and confidence about probiotics, the security, guidelines, and the scientific information. But the 5 of these topics were contaminated, if we can say this word, about opinion, behaviors, perceptions, and belief of these physicians. And the first thing that we saw about probiotics perception was a paradoxical awareness, because most of physicians feel informed about probiotics. 85% say that they were informed about probiotics, but 50% feel somewhat informed. And we saw a very high prevalence among gastroenterologists, adult gastroenterologists in China, 100%, and general practitioners in India, 91%. And the less prevalence about feeling informed was seen in Morocco with a 39%. we make three clusters in terms of the different countries, looking at these differences in percentage about feeling informed. And in the first group was the countries with most informed about probiotics, and they were India, Turkey, China, and Peru. When we talk about probiotic definition, we can see that a lot of doctors says that a probiotic is a bacteria or a yeast. 75% identifies that probiotic is a bacteria or a yeast, but they better known as a bacteria than a yeast, with a high percentage in Turkey up to 94%, and the less percentage seen were in Pakistan, 39%. When we analyze the mandatory elements in terms of probiotic definition, we can see that colonizing the flora, adhering to the mucosa, and rehydratation benefits has low scores in the different countries. When we saw about which strains were proven efficacy in antibiotic-associated diarrhea and acute infectious diarrhea, unfortunately, there were a lack of consensus of this, because physicians recognized almost 3 strains and up to 4 strains among gastroenterologists. More identification of scientifically proven probiotics were in India, Hungary, and Pakistan, and there were significant differences among surveyed countries. When we analyze the confidence levels, we can say that up to 89% were a high level of confidence, with difference across country. When we talk about confidence level, we see somewhat on absolutely confident about the use of probiotics. And this is a very high score for these doctors. And when we analyze deeper in this aspect, we can say that 79% in China, in gastroenterologists, are absolutely confident in the use of probiotics versus 52% of total physicians. And the less percentage were seen in Morocco, with 14% of gastroenterologists versus 32% of total physicians, with significantly, statistically significantly of these numbers. But no difference between medical specialties was seen except for China and Morocco. When we talk about probiotic safety, we can see with statistically significant difference that India, Italy, and Hungary were the highest percentage in terms of probiotic safety, and the less probiotic safety was seen in Morocco with 56%. And when we analyze different topics in terms of safety, we can see that unless Morocco was the country with less score index in terms of safety, surprisingly, in my country, in Argentina, we can see that doctors say that probiotics are not safe in children with a less score. And other countries, that Italy, Hungary, Pakistan, and China, at the bottom of the slide, you can see that has the highest scores in terms of probiotics that are safe in critically ill, immunocompromised patients. We can see a very wide range of percentage in terms of this case of safety. When we saw about personal recommendation in terms of probiotics, we can see that only 8% of doctors says that they don't recommend probiotics. So they say that 82% of physicians recommend probiotics to their relatives, and 68% of physicians use probiotics for themselves. There is a very high percentage in terms of recommendation of probiotics. When we analyze of clusters in terms of recommendation for different diseases, and we are talking about antibiotic-associated diarrhea, we can see that 60 up to 63% of doctors recommend probiotics for this disease, and 54% for acute infectious diarrhea, with the highest recommendation in Hungary, India, and Italy, and the less recommendation was seen in Pakistan, and for antibiotic-associated diarrhea in Morocco and Pakistan too. And when we analyze the different clusters in terms of pediatricians, gastroenterologists, or general practitioners, in this case, the highest score was seen in pediatrician, with 62% for recommendation in acute diarrhea and 67% in antibiotic-associated diarrhea. The percentage was similar to the other slide. And there is a very interesting topic in terms of why physicians don't recommend or don't prescribe probiotics. And the highest percentage was seen because not only they have enough experience with probiotics, but also they don't have enough information. 36% say that they don't have enough information. And when we analyze this, they say that they don't have enough clinical trials and there are no official guidelines. And we already know that there are a lot of clinical trials and there are current official guidelines in the use of probiotics. This is a very paradoxical matter in terms of this topic. And when we analyze deeper in this topic in terms of what happens with the scientific literature, we can see that only 11% of the total sample size don't read any abstract or any scientific literature related to probiotics. 56% read at least 1 to 3 abstracts a year, 19% 4 to 6, and 14% more than 6 abstracts a year. So we can say that the overall 89% of doctors read at least 1 paper a year related to probiotics. And where do they get the information related to probiotics? And 95% consider that they use professional information, and this is related to congresses, symposia, and courses related to this matter. And 60% says that public information is useful for know about probiotics. So, making a conclusion about this matter, we can say that most of physicians feel well informed about probiotics, and there is an unclear definition of probiotic, that is to say, because are more recognized as bacteria than a yeast, and there is no consensus on clinically proven strains. Up to 50% of doctors recommend probiotics for antibiotic-associated diarrhea and acute infectious diarrhea, and up to 60% use probiotics for their relatives or themselves. We discover in this survey that there is a positive perception on probiotic safety, and we know and we absolutely consider that there is the lack of information is a key obstacle for not prescribing probiotics, and more than 89% read at least 1 article a year related to probiotics. And we already know that continuous medical education on probiotics is a fundamental key to promote awareness. So, to conclude, we can say that this is the first multinational survey on probiotics awareness, and we know that more international studies are needed to increase probiotics awareness among the scientific community. This is the group that we participate in the survey of probiotics, and let me say that Dr. Saad Francisco Warner, Aldo Marui, we have the pleasure to stay in the audience today, and I give my thanks to all the other participants in the survey. And this is a picture for some of the participants of the survey. And this is the International Study Group on Probiotics. And in the bottom of the slide, I can show you some of my country, that is Argentina. Thank you very much for your attention.